this is to apply and take off a wet dressing. First, I would introduce myself to the patient, and next I would confirm the patient with our two identifiers, and then I would ask if it's okay if we replace your dressing today, and then I would go provide some privacy, wash my hands, and then put on my gloves. Normally I would have two, right now I have one. This is my equipment over here. My sterile gauze in container, my fresh saline, my medical tape, my surgical pad, and my gauze. Oh, and my tweezers. Okay, first normally this would be taped down to the skin, and we would remove towards the wound, and we would remove it and place it in the biohazard bag. And we would do the same with this gauze. Next I would get my tweezers, and if it's sticking to the skin, I would use fresh saline to remove it. Now we would gently remove the gauze on the inside, if I can. And place it in the biohazard bag and remove what's left in there. Next I would wet my gauze with the saline, and we would clean the inside of the wound, making sure there's no lesions, cuts, or bumps, and clean the outside of the wound as well after, and place that in the biohazard bag. And then we would go one direction with the wound, place in the biohazard bag. Do the same thing. Place, clean, one direction, biohazard bag. Next, I would remove my gloves, throw it in the biohazard bag, wash my hands, and put on new gloves. And I would apply new dressing. I would wet this dressing to go into, to make sure it covers the complete wound. Sometimes you'll need more than what is necessary, depending how big your wound is. Then you would cover it with your sterile gauze and put your surgical pad over. Tape it down all the way around onto their skin. Then I would initial and date and put the time of the time that it was re-put on.